Good afternoon, everyone, and welcome to today's SOAR webinar on strategies and considerations for representing older adults with Social Security Administration benefits. My name is Pam Hine, Senior Project Associate at the SAMHSA SOAR TA Center, and I will be your moderator today. Just a few items to review before we begin. This training is supported by the Substance Abuse and Mental Health Services Administration and the U.S. Department of Health and Human Services. The contents of the presentation do not necessarily reflect the views or policies of SAMHSA or DHHS. This training should not be considered substitutes for individualized care and treatment decisions. But just a few webinar instructions. So the slides, materials, and the presenter bios are all available on the SOARworks website at soarworks.samhsa.gov/events. The link to the SOAR website can be found also in the reminder emails you received about the webinar. And you'll also receive an email after the webinar with a link to the materials as well. So the recording will be available within about a week on the SOAR website and later also on YouTube. So we will take all of your questions at the end through the Q&A chat button. So please submit questions using that Q&A feature, and we will take questions at the end. So all the participant lines will be muted and the chat feature is disabled. So there is an evaluation at the end, so your browser will redirect you to the survey following this webinar. We really appreciate you taking the time to fill that out as it informs future webinars as well. So also, as you can see, we have ASL interpretation, with John and Linda, as well as live captioning with Becky today to enhance accessibility. So to view captioning, click live transcript and select subtitle. For ASL interpretation, you can pin the interpreter video by selecting the 3 dots in the upper right-hand corner of their video. So now I'm pleased to introduce Doreen Gross, a PATH Program Coordinator and SOAR Core with the Division of State and Community Systems Development at the Center for Mental Health Services at SAMHSA, who will give our welcome today. Doreen?
Thank you, Pam, and welcome everyone. A warm welcome to all of you for joining us today. On behalf of the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, I welcome you to this SOAR webinar titled Strategies and Consideration for Representing Older Adults with SSI and SSDI Claims. On this webinar, you will hear from experts who will share information on serving the older adult population with their Social Security claims and various resources to help them meet their unique service needs. We will be joined by a SOAR beneficiary who will share their lived experience in navigating the disability process and connecting to vital resources with support from a SOAR provider. I would like to say again, welcome and thank you, and also thank our presenters for their willingness to share your expertise on this important topic. I will turn it back over to Pam, who will be moderating today's session. Pam, it's yours.
Sure. Thanks again for your support, Doreen. So here are some objectives. So we hope by the end of this webinar, you'll have a better understanding in the increase of homelessness for older adults with disabilities, so your programs can provide more appropriate services and resources. And also learn how to represent older adults with their SSI and SSDI applications by applying various SSA rules and regulations applicable to this population, and exploring how you can connect older adults to programs and resources to support their unique service needs. So to help us reach these objectives, we have an excellent panel with lots of experience with providing resources and also representing applicants with Social Security claims. So to begin, we'll have Ryan Elza, Housing and Innovation and Strategy Lead with the Center for Innovation and Partnership at the Office of Interagency Innovation at the Administration for Community Living, or ACL, out of Washington, D.C. Then we'll hear from Kate Lang, who has many years of experience understanding SSI for adults, and she is the Director of Federal Income and Security with the Justice and Aging in Washington, D.C. And then we'll hear from Arnita Miller, who is an SSI Ohio project specialist at Free Store Food Bank in Cincinnati. Arnita has had great success working with the older population, and she's going to share really some unique things that she's learned about serving this population. And then we'll also hear from Jerry, who was a SOAR applicant working along with Arnita on his Social Security disability and Social Security retirement application. So we'll hear a bit from Jerry about his experience working with a SOAR trained case manager. Then, of course, we leave plenty of time for questions and answers. So let's start now with Ryan, who's going to share some resources and a little bit about, the aging population in the United States as well. Ryan?
Thank you so much, Pam. Hi, everyone, and thank you for having me today. As mentioned, my name is Ryan Elza, and I'm the Interagency Housing Innovation and Strategy Lead for the Administration of Community Living, which is an operating division of the U.S. Department of Health and Human Services. Today, I will be discussing realizing housing stability for people with disabilities and older adults, and opportunities to partner with the Aging and Disability Network to achieve this goal. So first, I'd like to tell you about the Housing and Services Resource Center, or HSRC, which was launched in partnership between the U.S. Department of Health and Human Services and the U.S. Department of Housing and Urban Development. The Housing and Services Resource Center fosters cross-sector partnerships between organizations and systems that provide housing resources and homelessness services, healthcare and mental health services, independent living services, and other supportive services. The HSRC is a part of an interagency initiative to streamline and expand access to affordable, accessible housing and the critical services that make community living possible. Homelessness is also a major issue for people with disabilities and older adults. Nearly 50% of individuals who use homeless shelters over the course of the year report having a disability. Our HHS colleagues at ASPE, which is the Office of Assistant Secretary for Planning and Evaluation, recently published a report in 2023, and this report gives an overview of the population of older adults at risk of or experiencing homelessness and what services and supports are available to serve them. The number of older adults at risk of and currently experiencing homelessness has increased rapidly in recent years, and a trend that is projected to continue and further accelerate. Older adults are the fastest growing age group of those experiencing homelessness. Nearly half of the homeless and comprise nearly half of the homeless population, and is expected to triple by 2030, which is a really startling trend that should concern all of us. Older adults are especially vulnerable to homelessness, as many live on fixed incomes, and half of renters ages 50 and older pay more than 30% of their income on housing. Compared to their housed counterparts, older adults experiencing homelessness have higher rates of health service utilization and more health and health-related concerns, including higher rates of mental health and substance use disorders, higher rates of chronic illnesses, geriatric conditions, cognitive impairments, as well as high blood pressure, arthritis, and functional disability, greater need for healthcare supports such as access to medications, durable medical equipment, assistive technology, as well as assistance with ADLs, and food insecurity, lack of transportation, and loss of community surface as additional challenges for older adults experiencing homelessness. For those of you who aren't familiar with ACL, our mission is to make community living a reality for all people, regardless of disability or age. We have aging and disability networks made up of over 20,000 community-based organizations in every state across the country to provide direct services and advocacy to make this a reality. Organizations in these networks, like area agencies on aging, centers for independent living, are staffed by people that live and know the community and culture. For example, 76% of board members and 64% of staff at centers for independent living have a significant disability. Knowing the community and the services available are important when helping people find and secure housing and services. The network serves a diverse population. For example, in 2019, through the Older Americans Act, the network served over 10 million people with approximately 2.7 million registered clients. And of these clients, 32% were a minority population, 34% live in rural areas, and 33% have incomes that are at or below the federal poverty level. These networks have decades of experience in helping people access and enroll in publicly funded programs and receive home and community-based services, housing, and housing-related services. Partnerships are another foundational element of these networks to streamline access to the services for the people we serve. Here you can see a list of the many types of organizations that make up the disability and aging networks. Aging and disability resource centers, no wrong door systems, as already mentioned, area agencies on aging, centers for independent living, councils on developmental disabilities, elder rights and services, adult protective services, assistive technology act programs, benefit enrollment centers, protection and advocacy programs, and university centers for excellence in developmental disabilities. You can learn more about these organizations at acl.gov, and all of the resources that I've mentioned today will be sure to drop in the chat after my presentation. For many older adults and people with disabilities, community living requires both access to affordable, accessible housing and a range of community services, including home and community-based services, behavioral health services, and tenancy supports. Home and community-based services, or HCBS, are person-centered care delivered in the home and community to enable people to stay in their homes rather than moving to a nursing home or other facility to care or for care. You can see examples of the types of home and community-based services delivered through the Disability and Aging Network listed here on the slide. So how do I find the Disability and Aging Network agencies? You can find a list of the programs and resources for housing assistance and programs and services to support community living at the HSRC website. All of the programs and resources on this page are operated or funded by the federal government, and I will drop a link in the chat. The Disability Information and Access Line dial helps people with disabilities get connected to information about local community resources that support independent living. Launched in 2021 to help disabled people access COVID-19 vaccinations, DIAL also provides information about essential services such as transportation, housing support, disability rights, and more. The Elder Care Locator can connect older adults to the resources available where they live. There is a 1-800 number that is available Monday through Friday from 9 a.m. to 8 p.m. And you can also visit the website to chat live or browse resources. You can also locate your State Assistance Technology Act programs through the link that will be provided to help that. And these programs help people learn, use, and acquire assistive technology and that enables them to carry out activities of daily living independently. The HSRC is your resource center. So please email us at hsrc@acl.hhs.gov about your technical assistance needs, website suggestions, and your own cross-sector partnerships. You can sign up for the HSRC listserv at the HSRC website to receive notices about upcoming webinars, new resources or tools, and the latest updates. So thank you for allowing me the opportunity to present today. And with that, I'll turn it back to Pam.
Thanks so much, Ryan, and sharing your resources. As you can see, these are all active links on the slides. So we encourage you to join the ACL listserv, and SOAR is all about building partnerships and growing our networks. You may even find SOAR trained folks in some of these agencies, and if not, we can talk a little bit later about how to bring SOAR training to some of these organizations. So now we're going to kick it over to Kate Lang, who's going to dig a little bit more into Social Security benefits and her knowledge about serving this population. Kate?
Thanks, Pam. My name is Kate Lang, and I'm with Justice and Aging. We're a national nonprofit organization that uses the power of the law to fight senior poverty. Oh, too quick. There we go. So I'm going to start my presentation just by talking a little bit about ageism and inequities, because fighting those are really central to all of our work at Justice and Aging. So age-based inequities arise from structural discrimination based on age. This form of structural discrimination, known as ageism, this is the systemic devaluing of older people based on cultural norms that lead to assumptions that older individuals have less to offer than younger people. In our society that devalues and ignores older people, low-income older adults struggle to make ends meet, and it makes it difficult for them to age in their communities and get the supports that they need. Many low-income older adults also experience barriers because of the impacts of other forms of discrimination based on other identities, such as race, gender, disability, and sexual orientation. Simply looking at age can mask the presence of other inequities that some older adults experience, especially as age can compound the impacts of a lifetime of discrimination. Inequities and discrimination based on age combine with other forms of inequity to uniquely disadvantage specific groups of older adults. Everyone is aging, but not everyone experiences ageism in the same way. This link will take you to a report from Justice and Aging, Fulfilling the Promise of Equity for Older Adults, that we published in October of last year, if you're interested in learning more about fighting systemic inequities for older adults. So now I'm gonna dig in on SSA benefits for older adults. Retirement benefits are based on the individual's own work record. And I should point out at the start here that 70% of people receiving benefits from Social Security Administration every month are receiving retirement benefits. So when people talk about Social Security benefits, a lot of the time they're thinking about retirement benefits because that's what the vast majority of people receiving benefits from Social Security are receiving. It's almost 50 million people every month are getting retirement benefits. So those benefits are based on the individual's own work record. They have to have 40 quarters of work to be fully insured for retirement benefits. And the earliest age of eligibility for retirement benefits is 62. However, if somebody starts receiving those benefits at 62 or any time prior to their full retirement age, those benefits will be reduced for the rest of their life. So the full retirement age is gradually increasing to age 67 for people born after 1938. So my full retirement age is 67. If I start claiming my retirement benefits when I turn 62, there's going to be a 30% lifetime reduction in my retirement benefits by claiming them early. I've provided you with a link here that takes you to the Social Security Administration's website, where they have a chart that explains what people's full retirement age is based on their year of birth, and then provides you with the calculation of how much their benefits will be reduced if they do claim early before their full retirement age. So there is some complicated math involved in figuring out how much a reduction in benefits somebody would have if they were to claim early based on what their retirement age is and what their current age is. You don't have to do that math. The agency has done it for you. So you can click through and look at those tables that provide you with the calculations showing what the benefit reduction will be. So when you do decide, if you decide that's what's good for you, some people, when they turn 62, they need the income. It makes sense for them to claim their benefits early. They want to take retirement benefits early. So some reasons somebody might do that is they need the income now. They don't want to wait until they're older. And they don't have to go through the disability determination process. I'm sure many of you on today's webinar know about how difficult that disability determination process can be. So one of the upsides of early retirement is you don't have to go through that early determination process. You just apply. Most people apply for retirement benefits online. There's a relatively simple online form. You just provide Social Security with your information. They look in their records. They say, yes, this person is insured for retirement benefits. Yes, they have reached age 62, and they start paying your benefits. So it can be very quick. It can take just a month or two to start receiving early retirement benefits. But I want to make sure everybody is clear, there will be a permanent reduction in your benefits by claiming them early before your full retirement age. And that doesn't end when you reach your full retirement age. It continues for the rest of your life with that permanent benefit reduction. And also to remind people that there is no Medicare coverage based on age until age 65. So even though you might be receiving retirement benefits from the Social Security Administration before you've reached age 65, you're not going to be eligible for Medicare coverage until you reach age 65. And there is what's called an earnings limit or an earnings test for people who are receiving retirement benefits before their full retirement age. This, again, as with all things Social Security, is very complicated, but I wanted to make sure people were aware of that and provided you here with a link where you can learn more about that earnings test for people receiving early retirement benefits on the Social Security website. So, Social Security disability insurance. People are eligible for SSDI up until their full retirement age. So there is kind of this, there are years between 62 and the person's full retirement age where they are eligible for both at the same time. And it can be unclear about which you should be claiming, receiving. So hopefully I'll be giving you some information so you understand those choices better. One upside of receiving SSDI up until your full retirement age, if you are eligible under the disability standard, is that it is an unreduced benefit amount. There's no penalty for claiming early before your full retirement age. The downside is you have to go through the disability determination process. And there is a 24-month waiting period for Medicare coverage. So looking at these together, early retirement and SSDI, you can apply for both at the same time. You can apply for one now, the other later. You can go shift back and forth between them. And for many people, filing for early retirement can provide income while they are going through the disability determination process. Usually, for most individuals, that disability payment is going to be higher than their early retirement amount, but not as high if they didn't take the early retirement before receiving SSDI. So if they start receiving early retirement now and then switch to SSDI later, those disability benefits are going to be reduced by a small amount, 0.05% for every month that they receive early retirement prior to that first month of disability benefits. And I provided you here with a link to the POMS that explains this in more detail. The POMS is Social Security's Program Operations Manual System. So this is all of the sub-regulatory guidance and instructions that SSA provides to its own employees, and many sections are publicly available, so we can look at those POMs and see what they say and try and understand them, and to try and better understand SSA's rules about these things. Oops, sorry, too quick. There we go. So, applying. As I mentioned, most people apply for retirement benefits online. The form is SSA 1. This is the form. But most people, rather than filling out the paper form, you can find the paper form on SSA's website, but most people use the online application. It's pretty simple and straightforward, and it's an easy way to get your retirement application filed with the agency. There is a question on that application form that says, during the last 14 months, have you been unable to work because of illnesses, injuries, or conditions that have lasted or are expected to last at least 12 months or can be expected to result in death? Most people read this question and have no idea what they're asking. They're basically asking, do you want to apply for SSDI at the same time as you're applying for retirement benefits? So if we've asked them to change the wording of this question so that, it would be in plain language and people would understand what they're asking, but SSA feels like the wording of this question reflects their policies, so they aren't interested in changing this question to make it more intelligible to people who are filling out a retirement application. But if you did want to apply for SSDI at the same time you're applying for early retirement, you would check off yes to this question. And then the follow-up question is, what date did you become unable to work? You would give your estimated onset date, right? People who have done disability applications know you have to come up with an onset date, a month and year of when your disability prevented you from working. So similarly here, you're going to provide your estimated onset date. So that's how to apply for SSDI at the same time you're filing for early retirement. And then SSA is going to follow up with you to start the disability determination process. If you're applying for SSDI when you're over age 62, but you don't indicate, you haven't filed a retirement application, the SSA is going to contact the claimant to ask them if they want to file for early retirement. So just be aware that that's probably going to happen, and you want to talk with claimants about whether it makes sense for them to start taking early retirement while they're waiting for their SSDI application to be processed. I also wanted to mention other kinds of benefits that people might be eligible for. These are, as I mentioned, most people think of retirement benefits when they think of Social Security, but there are other programs, other types of benefits that people might be eligible for. It's worth knowing about them and talking with claimants about what else they might be eligible for. particularly if they don't have a sufficient work history on their own record to be insured for retirement or disability benefits, they might be eligible on somebody else's work record. So it's worth having a conversation about this to kind of do a screening. And you want to ask that, you want to let them know why you're asking these questions, about previous marriages or whatnot. It's so you can explain to them, I'm trying to understand if you might be eligible for some other kinds of benefits. So one kind is spousal benefits. A spouse or a divorced spouse of a retired or disabled worker, and you're age 62 or older, or caring for a child who's under 16 or disabled, the child of the worker, you may be eligible for benefits on the work history of that spouse or ex-spouse. If you are claiming on the record of somebody you've divorced, you had to have been married for at least 10 years before you were divorced, but you don't have to know where that person is now. You don't have to talk to them. SSA is not going to talk to them if you apply for spousal benefits. Right? SSA isn't going to contact your ex and say, your former spouse is applying for benefits on your record. Is that okay with you? Right? They don't get any say. They're not going to be contacted by SSA. You don't have to know where they are. You're going to need to tell SSA their name and their date of birth, but you don't even have to remember their social security number. SSA will try and identify them in their systems and see what their work history is and how much you would be eligible for on their record. And I've provided you with links here to the Social Security website where you can read more about eligibility requirements for spousal benefits and divorced spousal benefits. And, as it requires that the spouse or ex-spouse be receiving retirement or disability benefits from SSA. There's also benefits for people where that spouse or ex-spouse has died. So surviving spouse benefits or widower benefits are also a possibility if that person you're currently married to when they died or you were married to in the past. You may be eligible for benefits on their work history. Again, if you were divorced when they died, you had to have been married for at least 10 years in the past. And there's also, so those are surviving spouse benefits for those who are age 60 and older. Generally, with these, what I call auxiliary benefits or dependent benefits, Social Security will look to see if you'll receive more on your own work history or the spouse's work history, and you only get one, whichever is more. For the widower benefits, you can start receiving those widower benefits, and then when you reach your full retirement age, you can elect to change and start receiving your own retirement benefits then. But generally, SSA will just give you one, whichever one is more. And there are also benefits for widows or widowers who are disabled starting at age 50, as long as the disability started within 7 years of the worker's death. And again, you would have to go through the disability determination process to be awarded disabled widower benefits. So, sorry, moving to the next slide. Oh, not good with these buttons. Okay, and the last one I wanted to mention is childhood disability benefit or disabled adult child benefits. This is where the child is an adult with a disability receiving benefits on the work history of their parent, and the parent is retired, disabled, or deceased. Again, adult child over age 18, and their disabling impairment began before age 22. They go through the disability determination process for adults. They need to be unmarried with some exceptions, and must not have substantial gainful activity after age 22. Sometimes people think of these as benefits for younger adults, but I have to say, I was able to get disabled adult child benefits for a man in his 50s. Right? It was difficult. We had to come up with medical records from 35 years ago to show that his disabling condition was diagnosed and treated before he turned 22. But we were able to show that. His mother had supported him her whole life and then had passed away when he was in his 50s. And he was really struggling. And we were able to get him benefits on his mother's work history. That really was, very, very significant for him and provided him with the income he needed. And here is a link to the SSA website that provides more information about those benefits. And then I can't end without talking about SSI, supplemental security income, which are benefits for folks who are disabled, blind, age 65 or older, and who generally don't have a sufficient work history to be insured for retirement or disability benefits. They're for low-income people. There's means testing, so folks have to have limited income and assets, and they have to be a U.S. citizen or certain limited categories of immigrants. I provided you with a link to SSI information on the agency's website. But I just wanted to make sure that people were thinking about SSI today. Also in the context of being a supplement to the other benefits I've already talked about. If somebody is receiving early retirement, a low amount of early retirement below the SSI limit, so less than $950 a month, they might be eligible for SSI. And the agency is not going to consider them whether they're eligible for SSI unless they apply for it. They have to affirmatively ask for it. The agency is not going to ask them if they want to apply for SSI. They have to ask for it themselves. So particularly for folks, receiving a small amount of early retirement or a low amount of spousal benefits, it might be worth applying for SSI so they receive that additional income. And also in most states, they'll be connected to Medicaid. So that can be a really important source of health insurance for people. Okay, so now I'm gonna mess up again. Here we go. I'm going to talk about the disability determination process for older adults. This is the 5-step process. Hopefully folks are familiar with the disability determination process. I'm going to focus in a little bit on step 3, whether the claimant's impairment meets or equals a listing, or step 5, if there's any other work in the national economy that the person can perform. So step 3 and step 5 are where people are awarded benefits. So I'm going to highlight those for things to think about for older adults. So at step 3, I just wanted to highlight a few common listings for older adults. These might be listings that you're not familiar with. So I just wanted to encourage people to look at these listings to see what they say, what they require, and whether they're applicable for the claimants you're working with. So arthritis, of course, SSA doesn't call it arthritis. They call it abnormality of a major joint in any extremity. Again, diabetes is under endocrine disorders. Heart disease is under cardiovascular system. Strokes, or it's called vascular insult to the brain, is the particular listing to look at. Degenerative disc disease is disorders of the spine. COPD or emphysema are covered by chronic respiratory disorders, and cancers. There's a whole section of the listings on cancers. So the requirements to meet or equal a listing are quite high, but it can be worthwhile to be familiar with the listings, to look them up if you are serving an older adult who may have an impairment that you're not familiar with the listing for that impairment. It's a good idea to go ahead and make yourself familiar with those listings, because they might meet or equal that listing, and that's a pretty easy application for you to help with. Next, I want to turn to step 5 of the process, and to note that at step 5, the burden shifts to the Social Security Administration to prove that the person can do a job in the national economy. So when you reach step 5, SSA has to take into account what's known as medical vocational guidelines. So these rules are meant to provide consistency and uniformity in the treatment of adults applying for disability benefits. So it takes into account the medical and vocational factors required by the Social Security Act and calibrates these factors to ensure that individuals with the most adverse vocational factors get those factors considered. So the assumption is that those who have fewer physical limitations, who are younger, with more education, more skills from work, are better able to adapt to new work, are able to make what SSA calls a vocational adjustment to a new job, to something that they may not have done in the past. So the grids do not apply when the individual has solely a non-exertional limitation or impairment. So these would be mental impairments, cognitive impairments. If the person only has mental or cognitive impairments, then the grids don't apply. But the grids apply for folks who have physical impairments or a combination of physical and mental impairments. So these rules are considered, right? The agency is supposed to look at the grids to provide a framework for considering how much of the individual's capacity is diminished. So these vocational factors, to how they're organized, are first by exertional level. So this is the RFC, stands for residual functional capacity, how much physically a person can do in an 8-hour workday. So sedentary work involves somebody who can sit 6 hours out of an 8-hour day and stand or walk for 2 hours, at least 2 hours, lifting up to 10 pounds. Light work, standing 6 hours out of an 8-hour day and lift up to 20 pounds. Medium, able to stand for 8 hours and lift up to 50 pounds. Heavy, standing all day, lifting up to 100 pounds. Very heavy, standing all day and lifting over 100 pounds. Then age. So how SSA categorizes people based on age. Age 18 to 49 are considered younger workers. 50 to 54, closely approaching advanced age. 55 to 59, advanced age. And 60 and older, closely approaching retirement age. Those are the categories in the grids. And then education, whether somebody is illiterate, whether they have a marginal education up to 6th grade, limited education up to 11th grade, or whether they have a GED or a high school graduate. Those are the categories that they consider. And then skills from work involve whether somebody has is unskilled, has no transferable skills from previous work, and whether skills are transferable or not. So we'll look at this. I provided you with the link where you can find these online. So this is what the grids look like. This is table 1 for those who have an RFC of sedentary work. And you can see the columns: age, education, previous work experience, and decision. And on these grids, where the notation is DO, that stands for ditto, which means the same as the line above. So the first line is for advanced age, and the second line where it says DO, also for advanced age, down for the next couple of lines there. And then you get to closely approaching advanced age. So you can see that based on people's profiles, the grids lead to a finding of disabled or not disabled. So you want to be familiar with these grids, particularly for people age 50 and older who do not meet or equal a listing. The grids are really, really crucial for getting people awarded benefits who are 50 and older and who don't meet or equal a listing. So that's the end of my slides. I'm going to hand it back to Pam.
Thank you so much, Kate. We really do appreciate you leaning into the grids. And I think that many of the SOAR trained case managers out there really do want to learn more about that step 5. And this is where Social Security considers age for the first time. So we really are so glad folks get to increase their knowledge in this area, and also your knowledge of applying for retirement benefits versus while they're waiting for their Social Security benefits to come through. These are questions we often get at the TA Center, and typical of case managers who have applicants in these types of profiles. So thanks again. We do have many questions that have been coming in. Hopefully your questions were answered because some of your questions were before Kate got to that subject matter area. So anyway, we'll try to get your questions answered at the very end. We do want to get to Arnita Miller and Jerry's presentation. So Arnita is a SOAR specialist in Cincinnati with Free Store and Free Store Food Bank. And Arnita is going to talk a little bit about Free Store and her experience. We know she's been really successful with this population. She's had many allowances that she has reported to the SAMHSA TA Center using OAT, the online application tracking. And she's sitting next to Jerry, who receives services through Free Store, who will share his experience and expertise. So I'm going to hand it over to Arnita, who is now unmuted. Take it away, Arnita.
Hi, everyone. How are you? As she said, my name is Arnita Miller, and I am with the Free Store Food Bank here in Cincinnati, Ohio. And we have many programs up under the Free Store. We have our benefits enrollment program, which consists of a person just walking in Monday through Friday from 8:30 to 4 to apply for Medicaid and for food stamps. So we have our payee program that works closely with the Social Security Administration for those individuals who need assistance with managing their finances. We also have our transportation assistance program for individuals who need assistance with bus transportation to get to and from work, or may just be starting a job and don't have finances or means to get back and forth. We assist individuals with that. Most people in the community like to see us say that we're the one-stop shop. And I have worked with individuals, experienced homelessness since 1991 in various capacities. I did 14 years, actually 14 and a half years with Greater Cincinnati Behavioral Health Services, working with those who are homeless and severely had mental health challenges and or substance abuse. And I led the PATH outreach services for 12 of those years, going under the bridges on the riverbanks and finding individuals, establishing a rapport and connecting them to services. So my last years until I retire, it will be here at the Free Store Food Bank, and I've been here 6 years. It'll be 7 years, April the 3rd. I am a member of the Homeless Outreach Group here in Cincinnati, which we call, the acronym is HOG. And that's where all the agencies come together, discuss homeless issues they're facing with the shelters, housing, finances, and just our homeless services in general. I am a member of our shelter house work group in Hamilton County, and basically that is where all the shelters come together and discuss how to improve things that can be done better in serving individuals who are in the shelters. And our Operation Stand Down is a program that historically started way back in the 90s, where we bring all social services together up under one roof so that the community will know what services are available out there in the community, because mostly what we hear, people don't know what services is available. So that's basically what I do and what I have done and have enjoyed doing and continue to enjoy doing. Now I'm here with Jerry. Okay, we're going to have, now I've met with Jerry. Jerry came to me from one of the PATH outreach workers who was working with him. Jerry was on the street at the time. So I'm going to ask Jerry a couple of questions. So how long were you homeless, Jerry?
A couple of years.
Couple of years. Will you say 2 or 3?
Yeah, at least 2.
2. Okay.
Working on 3 there.
Working on 3. Okay. And was this your first time of homelessness?
Well, I was homeless back in the 80s, but I wasn't really homeless. I mean, it was more of a substance abuse thing back in them days.
Okay.
You know,
Okay.
I was kind of young, and you know,
Okay.
just
Okay.
going from place to place.
All right.
You know, and I guess my young mind attacked my old mind and said, "Well, you can do this again." It's not like that nowadays. You know?
Okay. Okay.
You know, nowadays it's totally different. You know, it's not no substance abuse about it. You know, 'cause, you know, me, I don't drink and do drugs. You know, my problem is food, and, you know, freezing to death at night. And, you know, I mean, it's real now.
So what do you feel were your immediate needs at that time?
My immediate needs was getting some kind of shelter. I mean, you know, I had different things going on. I figured if I got a little house or something like that, you know, or a place where I could at least establish myself, more like a residence, I could get cleaned up, probably get a job. You know, I still had enough knowledge in my head to get a job, but you know, I was going through a lot of medical stuff too, and that was driving me insane.
Just to explain to you guys a little bit about his medical needs at the time when he connected with me. Jerry had had experienced frostbite and needed to go to the hospital. And when he did that, there were other medical things that were found out that he had greater medical needs than initially what he thought. did you have any transportation needs at that time?
Oh, yeah. They, here in Cincinnati, you know, I found out that the hospitals are, they're so far out from where you're at, you know. Uh, the hospital that I was at is a good 30 to 40 miles up north there. And, you know, the day I got out, you know, there weren't no places to send me. So they just kind of put me in a car and drove me downtown and let me out, more or less, you know. And that's kind of where it all began there. And, you know, I was walking, and that night something popped in my head and I ended up back in the hospital, you know. So, you know, so I knew right then, you know, that I've got to find some place. And running around asking all the street people, you know, where do you go to shower? Where do you go to clean up? You know, where do you go to, you know, a lot of them didn't know. I mean, they weren't trying to be mean about it. They just didn't know, you know. And, but a lot of certain people, you know, they kind of guided me to the free store. They said, "We'll go over to the free store." Then I met, of course, you know, Kenny and all them, you know, they're counselors of, you know, different group. And, you know, he said, "Well, yeah, we know, you know, let's go over here and talk to this lady here, you." And, this lady opened my door. I mean, she's an angel. And I mean, and I didn't know her name, but I've you know, you can say her name out there on the street and everybody knows her. Yeah. So they said, "Yeah, that lady knows exactly what she's doing. She won't take no crap, but she knows what she'll, you know, she'll show you how to do it, but you got to do it, you know." And that's kind of where I'm at right now, you know.
Okay.
Kind of figured I've done, you know, everything they told me to do. So, you know, that's kind of the way I'm working on it.
So do you currently have income?
Yeah,
And what is your income?
it's the retirement, the SSI retirement.
And they're still currently working on the disability
Yeah,
piece of
yeah.
it. And what about housing?
Well, I live at the Dana house, the Tender Mercy. It's a mental health ward. It's not a ward, but it's a little rooms, you know. It's not a major apartment, nothing like that, you know, but it's a place where you can feel safe. You can, you know, go there and you can shut your door at nighttime and lay down and not worry about the rain coming through the window or somebody gonna come up and knock you in the head just cause you're trying to sleep. And you know, to me, it's a mansion. You know, other people, it's probably a closet, you know, because it's probably no bigger than a closet. But to me, it's mansion. It's mine. And they take rent out, which I don't mind. You know, my check the retirement check, this place takes so much out for it, which, you know, you pay rent on out on the street. So, you know, I don't mind that, you know. And one day when I get a little better and stuff and get in shape a little bit more, I go out because I'm not a super smart man. So,
Don't say that.
well, today's world, it's all about, you know, computers and, you know, knowledge jobs, you know. Mine's more of a construction and physical jobs, I guess. And, but, you know, one day I'll get to where I'll be able to do that, get back out there, you know, and, you know,
Thank you.
make my life a little better.
But Thank you, Jerry. I just want to piggyback off what he said about, being an older individual and not being as smart as, although I wouldn't put it that way, but just how Jerry is that as SOAR workers, we have to be patient, we have to be kind, and we have to be the ones that advocate. And we have to know and be aware of what services is in the community so that we can make sure that we are providing. I like to see it as a holistic approach to our older adults who need services from us, and it may take a while for us to complete the application process because of what the immediate needs is. And in Jerry's case, it was coordinating him having the heart care that he needed. He didn't know, he didn't understand. The doctors were talking over his head. All he knew is that he had a heart problem. So he couldn't express it or explain it to me fully what was going on. So I had to help navigate him through this so that he would get the proper service and the medications that was needed. So just doing this work, which I really enjoy, I just find that working with older adults, it takes advocating, coordinating, and knowing what services is available and working directly with Social Security in order to help the person to obtain some stable income so they can remain in the community with stability. So I'm gonna turn it back over to Pam at this time and for Q&A.
Great. We can listen to you all day, Angel, Arnita, and Sherry. Great advice. And it is all about this today. It's all about learning about available resources. And sometimes when folks apply for disability benefits, not being aware that they could be eligible for early retirement, like Kate said, where they may maximize their income through both of those benefits. And it is sometimes it's not clear. So it's wonderful to have those relationships with SSA, use some of these tools that Kate shared so that folks can really access the benefits that they may be eligible for. So we might get right back to you, Arnita, to talk about how things are going right now with the disability portion of the application. A little bit about that. Is there a decision looming? And are you working closely with the DDS examiner?
Still working with the DDS examiner currently, as you know, there's been some changes with Social Security Administration, so things may be going a little slow right now, but it's still in the process. We're working closely together with them to get that decision as soon as possible.
Right. Well, we can't wait to hear how things go. And we have some great questions that we've been answering live. Abby at the TA Center has been answering questions. We also have some questions that are coming in for, all of the panelists. So what I'd like you to do, I see that you're coming back on camera so that we want to pose some of these questions that have been unanswered, to you and kind of get going for the next 20 minutes or so on getting these questions answered. And again, as I said, some of you asked questions that I'm hoping were answered as the panelists, especially Kate, was, going through her section on, which benefits do I apply for, and how to go about that. So I'm going back to Ryan, who shared that excellent ASPE report, and also the link to his agency ACL to find out how do I connect to those organizations within my county that can really help connect to these resources. Like Arnita was saying, some folks don't know what services are available and really to seek those out. Do you want to talk a little bit about that, Ryan?
Yeah, I'd be happy to. So the first resource I would point you to is Elder Care Locator. which allows you to search by your zip code for all of the aging and disability network organizations that might be available within your community. And on that website, it will list the contact information for those organizations, the types of services that are provided and available to you. And they also have a 1-800 number that is available, and also the dial resource as well has a 1-800 number and a resource where you're able to input your zip code as well. And then if you go to acl.gov, all of the different disability and aging network agencies and the types of agencies that are available within your community are listed there. So you can click on each of them to learn more about like what do those particular types of agencies and organizations do, what types of programs and services are available. And for those particular groups, you can also find links that will then link you to their locations across the country by specific verticals, such as like where are the AAA's, local area agencies on aging within your community, or a center for independent living.
Great. And we had a question from Stephen, and I think knowing about these resources could help find this resource for an individual who's living on the street and trying to find an assisted living facility. They just said assisted living due to her diagnosis, maybe having trouble finding an assisted living facility that would accept that individual. So what or who can they call for help? So for somebody with a particular maybe diagnosis, connecting to the right living arrangement, like assisted living.
Yeah, so I would reach out to your local area agency on aging and you can find them by using Elder Care Locator. And they have options counselors that can work with you in order to find, through a person-centered approach, the best opportunities, whether that is an assisted living or assisted living opportunities in your local area, or other types of housing, plus helping you to be able to line up home and community-based services that might provide a different option than an assisted living program.
Kate, if you wanted to add on, because what comes to mind is maybe the individual facing some possible type of discrimination and getting housing based on a diagnosis, and maybe other resources to get involved to advocate for that individual, especially if that housing, should be made available, to the individual. What kind of recourse do they have?
Right. I think that what Ryan said about contacting the local area agency on aging as a place to start is a really great recommendation. And also to realize that a lot of assisted living facilities aren't going to want to admit somebody who has no income. So sometimes getting them, obviously that's my bias towards getting people connected to income, can be helpful in terms of paving the way to finding a housing situation for them. But it can be a challenge, if you're approaching a particular assisted living facility, they might just say, we don't have a bed available for this person. I'm not sure you really have a sort of a civil rights complaint in that situation. So I would say it's my first priority would be towards contacting the area agency on aging to figure out what local options are and trying to get them connected to any source of income that they might be eligible for.
Okay. That's helpful, Kate, because again, if it's assisted living, they may have a certain amount of Medicaid beds that are available, and there may not be any. So there's a couple of questions that came in about maybe wait list for housing, and are individuals who are advanced age or older adults, prioritized on a waiting list. What generally can you talk about in terms of wait list, and does being deemed disabled help a person move up on a wait list? What's kind of going out there? What's trending maybe nationally in terms of wait list? And I don't know who would like to maybe take that, what you're seeing, Ryan, are there enough housing resources available for this population?
Yeah, happy to start, and others to jump in. So It really depends on your local area, but we can see wait list times being 6 months to multiple years, or having wait lists that are closed to new applications. And so depending on the types of housing that are available in your community, there are types of HUD, federally assisted housing, that are available and prioritize older adults. So Section 202 properties are for individuals 62 and older, and are project-based, which means there are property, the assistance is tied to the building. And then there are other types of buildings that aren't age restricted, such as project Section 8 housing, which also tend to have long wait lists. But those wait lists are managed at the property or housing authority level, and can also be coordinated at the county level. So unfortunately, oftentimes these wait lists are very disparate, and you'll have to go from individual property to property and understand what the wait list might look like in terms of applying, getting it on there. Properties do have the ability to create different preferences for individuals to be able to hop the line and be able, well, not hop the line, but increase priority in terms of how they're able to be placed into units. And those preferences could be based on things like individuals who are transitioning into community living out of institutions. It could be for people who are, preference for individuals who are currently experiencing homelessness to be able to get into units first. So those are really good questions to kind of ask at the property level to understand what some of the property preferences might be, and how might you be able to, think about being strategic in getting placed in those sooner. And then you will want to be able to also, understand who your public housing authority is in your area. So they'll operate housing choice vouchers, which are a voucher that enable individuals to take that voucher to a private landlord who accepts them to be able to be placed into units.
Yeah, Arnita, did you want to touch on maybe some housing availability, wait times, things that impact that, and maybe what you've been able to do to help connect individuals to housing, maybe while their applications are pending?
Yes, I usually use the housing that is available in the community. Our COC here in Cincinnati allows for when homeless individuals are on the street, our outreach teams are able to use what we call the VI-SPDAT, and it is the housing tool that scores where, let me rephrase that. It helps scores to let them know what housing to match to that person. And so it makes it much easier when they're starting from the street. So when they're working with other providers, they still have that housing piece going on, working on that. So sometimes the housing piece, they're able to move right in before they even connect up with the partnership agencies. But I do utilize our CMHA, metropolitan housing. A lot of our clients don't know that, if they're 55 and older, they're considered seniors. So they're still eligible for senior housing through them. And here in Cincinnati, they are building more, since the aging population is increasing, they're actually investing more in building more properties for 55 and older.
Great. Thanks for the local perspective. That's helpful to know, because many communities use different tools for their priority lists. So check into that, what you're using, and really help folks get into housing. even while their benefits are pending. So yeah, a lot of questions, Kate, that came in about spousal benefits. We get this a lot at the TA Center, and I know folks are, when you're sitting down, Arnita's probably done this, you, Kate, when you're sitting down with applicants and you ask that question about prior marriages, and individual doesn't want to share anything, so they feel like maybe they're taking away from that individual their spouse's benefits, or just don't want any part of that. And I think that that's an area that we can really help applicants understand that you're not taking away benefits. These are benefits that you've earned through your marriage. Can you share some takeaways, some information about spousal benefits and how important it is to make sure Social Security is looking into this and giving Social Security the information, like you said, so that they can connect individuals to benefits that they are rightfully due them?
Yeah, it's really important that you understand what the different eligibility requirements are for these different kind of benefits, so you can kind of target your questions to folks and let them know that's why you're asking. A lot of times when folks complete an application, they don't provide the information. SSA may ask for the information about prior marriages, but they're like, that's not relevant, right? Like, I'm not married to that person now. I haven't talked to them in 30 years. You know, the divorce happened a long time ago. I don't know where they are. I don't want to be in contact with them again. So I think it's important to understand you don't have to be in contact with that former spouse. You don't have to know where they are. SSA isn't going to contact them to let them know they're considering you for spousal benefits on their record. And it's not going to impact that former spouse's benefits at all. Their benefits aren't going to be reduced because you're collecting benefits on their record. They're never going to know that you are collecting benefits on their record. So it can be a really important source of income for people that they don't know about. They don't realize that they might be eligible for benefits on a former spouse's record. And, you know, they should not hesitate to claim those benefits, to see, you know, you might not know how much your former spouse has earned over the past 30 years, so you don't know what the amount would be. You should, you know, let Social Security know that you were married to that person, so Social Security can do the calculations and see whether you might be eligible for more benefits on that person's record. And I will say, you know, people saw my email address on the slide earlier. Maybe it can be put in the chat again, so people can reach out to me. I want to be clear, I can't provide people legal advice about their particular situations. I don't represent people at the Social Security Administration, but I can answer questions about SSA benefits and rules. I'm always happy to do that. There I am in the chat. Please don't hesitate to reach out to me. And if you have asked a question on today's webinar that wasn't answered, I can follow up with people by email later. I'm always happy to answer questions. And I did want to let people know that I am going to be offering a webinar through the National Center on Law and Elder Rights at the end of April about spousal benefits, about all these different kinds of auxiliary benefits. We're going to be doing a webinar on those. So I will have more than like 10 minutes to talk about spousal benefits. We'll do a whole hour on auxiliary benefits at the end of April. So if folks are interested in learning more about that webinar, they can reach out to me by email, and I will send them the registration information when it becomes available.
Yeah. Great. Thank you so much. We often here at the TA Center join the NECLR webinars, and they're excellent. You get some great information that it goes beyond what you learned in the SOAR training. And just hearing this information over and over again really does help, because like, as Kate said, it's not clear. The language Social Security uses is not always that clear. So helping to simplify it and understand how benefits impact each other and what you may or may not be eligible, because sometimes we'll get questions that you know, make our role as the SOAR caseworker more of a financial advisor, like what's best for me to do for my family, you know, for me and my spouse, you know, should I take early retirement? Should I, you know, wait until full retirement? These are questions we all ask ourselves as well. And again, being put in that role can be very difficult, but knowing the options and SSA could be your best resource. I love how Kate shared that retirement calculator. That would be a great thing to start sitting down with your applicant to work out some of those numbers for you, because again, it's sometimes hard to tell because of it's not clear and there's different factors involved, what works best for you. I think the example, I think Jerry said, you know, just working, like wanting to, you know, go back to work. A lot of folks are working while, you know, they have a disabling condition, but they have to work to survive. So taking that early retirement at 62 may be the best option at that time, but also knowing that SSA is not going to proactively put an SSI application in front of you, right? So Kate, can you talk a little bit about that? You know, applying for SSI, we had many questions coming in about that, applying for SSI after you took early retirement, maybe provide some guidance, you know, in that general area.
Sure. So I will say, I did see some questions from people saying, oh, can I take SSI and wait till my full retirement age? An application for SSI is treated as an application for any Title II benefits. So any retirement, survivors, auxiliary, disability benefits. So when you file that application for SSI, SSA is going to look at your work history and the work history of your spouse, anybody else, and see if you might be eligible for any of those benefits, because SSI is treated as a benefit of last resort. So they are going to consider you for those other types of benefits to see if you are insured, your spouse is insured, a former spouse is insured, that you might be eligible for those benefits before they would award you SSI. So again, if you are awarded those Title II benefits, if it's less than the SSI amount, then you would be could be eligible for SSI as a supplement to the Title II benefits. So you would be what we call a concurrent beneficiary, receiving both. You could be receiving both early retirement and SSI, but the SSI is treated as like a supplement. And you will be considered for any Title II benefits you might be eligible for when you file an application for SSI. But the reverse is not true. SSA does not look to see if you're eligible for SSI when you apply for any other benefit, retirement, survivors, disability. You have to affirmatively ask for the SSI. You have to say, I want you to look at me to see if I'm eligible, you know, for the financial eligibility rules for SSI. And I think there are many, many people out there who could be concurrent beneficiaries who are receiving a low amount of retirement or survivors or disability benefits, who could be eligible for SSI, but they don't know that they need to apply for it and go through that application process for SSI. So I would encourage folks to look into applying for SSI if they are receiving a small.
I see you nodding, Arnita.
Yes, I was going to say that when you're working with individuals, you're supposed, as SOAR workers, do the 8,000 plus the 3368, which is the SSDI. And if you're simultaneously turning both of those in, and once you do the 3368 online, it's going to pop up, generates that, you know, when would Jerry like to start his retirement? So you typically would do both anyway to make a complete application for SOAR.
Exactly right, Arnita. Yeah, that's what the SOAR training is all about. You know, we expect both, and SSA expects both SSI and SSDI applications to be submitted, knowing that Social Security will determine if an individual is eligible based on their own work record or that of another, like a spouse, that we've talked a lot about today. So I think that's really great to see it in practice, and how SOAR case managers are now armed with that information to make sure that they're applying for both of those benefits. And we often get that question, that applicant, that we need to put in an SSI application that wasn't taken. So that's quite common. And Arnita, it sounds like you have experience doing that too, maybe putting in that SSI application for a low SSDI beneficiary where it's so low, you need to be brought up to that SSI federal benefit rate. So yeah, that's why I can see you nodding. I'm sure you do that, and many out there have that
Yes,
experience.
yes.
So just, yeah, did you want to share about that? Or before you do that, I just want to share a comment that came in that was just so nice. For Arnita, do you find it best to have all those services like food stamps, SNAP, et cetera, all in one place? Like you said, your one shop. Is there any benefit to having them available for clients located at other organizations? So maybe how often do you network and utilize services from other agencies?
Actually, we utilize them Monday through Friday every day. I am not stationed just at the Free Store Food Bank. I'm out in the community, and I'm at the shelters. I'm in the community. I'm at churches because their churches have things going on. I'm out there, so I let the community know what's available, and they let me know what is available for us here at our agency. I just do the SOAR. My other teams do the SNAP and the Medicaid. So they're out at different sites and in different counties. So we have a benefit call center too, that we get calls for Indiana, some other parts of Ohio, so that we're able to do their applications also. So yes, we just don't do it just with our county, Hamilton County. We do it with throughout the county of Ohio and Indiana and Kentucky.
Great. And Kentucky, you're right on the border there. So just some great comments. Jerry, a lot of people thanking you for sharing your story and wishing you luck with the rest of your application and getting into the other housing that you are looking forward to in the future. And thank you for sharing your story, Jerry. Thank you, Jerry. Yeah, a lot of thank yous. People are really learned a lot from your experience. Thanks to Arnita for your hard work in the trenches. Somebody wanted to say, this is such a heartfelt message. I love it. Arnita, keep up the outstanding work, getting others in a safe place and peace of mind. So just some really great feedback coming in for Ryan sharing those great resources. A lot of folks were not familiar with many of the organizations that you were, talking about. I think that can really connect folks at that county level to look at housing waiting lists to get into, housing that they may be eligible for. So they're thanking you for all of these resources and that ASPE report. So people are really looking forward to digging into that and learning more about this population. So before we leave, I know we're running out of time. I just wanted to ask the panelists if you wanted to share like your takeaway, what you want, folks in the SOAR community to kind of go away with too. And I'll start with Ryan, if you want to just share some of your closing thoughts.
Yeah, thank you very much. And I echo all the wonderful comments for Arnita and everything that was shared today. This was a really great webinar. I would just say, a rising tide lifts all ships, and it takes a community and a village to do this work. So please do reach out to your local aging and disability network organizations and agencies and figure out how you can coordinate and collaborate together in order to advance community living and help people remain stably housed in the community.
Kate, any closing thoughts?
Just thanks to everybody for attending today. It's been such a pleasure to serve on this panel. And I hope you will think of me and Justice in Aging and the National Center on Law and Elder Rights as a resource. I'm such a fan of SOAR and the work that all the providers are doing that I want to make sure that they have the support they need to keep doing outstanding work.
And Kate means what she says. She will answer your question. And Arnita and Jerry, any closing thoughts?
My only closing thought is that I want to thank everyone for what they're doing. You know, we can't do this without each other. And just to be mindful that when we're working with individuals, whether they're, I would like to say the silver sneakers or not club, you know, to remember to treat everyone with dignity and respect. But most of all, find out what's available in the community where you're at. If you don't know, just go to the housing resources or to the housing places and see what their procedures is. And just know and be aware of resources in the community. How about you, Jerry?
I'd like to thank everybody, and you guys are doing an excellent job. I mean, I can't thank you enough for what you've done for me. Thank you very much.
Thank you, Jerry.
Okay. Well, thanks again, everyone. We are out of time. We know that you've gained a lot from this webinar. We have a short evaluation we'd love for you to complete. You also have an opportunity to ask a question if you weren't able to do it in Q&A. So please take a minute or two to do that for us. And contact the SOAR TA Center too, like anytime with your questions. Our next webinar will be in April 17th on the topic of SOAR implementation within permanent supportive housing programs. So look for registration to come for that shortly. And again, I just want to thank the panelists, Ryan, Kate, Arnita, and Jerry, for sharing your expertise with us. We all learned so much. And again, thank you so much and enjoy the rest of your day, everyone. Thanks again.